Brachial artery. The brachial artery is a major artery that's supplying the arm, and it is the continuation of axillary artery of the inferior border of the teres major muscle. Runs downward and laterally across the elbow joint. It enters the cubital fossa and terminates by dividing into two branches, radial artery and ulnar artery, at the level of neck of the radius bone. Its relations are as follows. Anteriorly at the upper part, it is related to the medial cutaneous nerve of the forearm. In the middle part, it is crossed from lateral to the medial side by the median nerve, and in the lower part, it is crossed by the bicipital aponeurosis. Posteriorly, from above to downward, it is related to the long head of triceps, medial head of triceps, coracobrachialis, and brachialis muscle. Medially in the upper part, the ulnar nerve, and the lower part, the median nerve. Laterally in the upper part, it is in relation with the median nerve, coracobrachialis and biceps brachii. In the lower part, the tendon of biceps brachii. Its branches are as follows. The profunda brachii artery, superior ulnar collateral artery, inferior ulnar collateral artery, nutrient artery to the humerus to the nutrient foramen, muscular branches, and the radial and ulnar arteries, which are its terminal branches. Pulsation of this artery are felt or auscultated when taking the blood pressure. Profunda brachii artery. It arises from brachial artery anterior-posteriorly below the border of the teres major muscle. It leaves triangular space along with the radial nerve and passes down along with the radial groove. It then divides into deltoid branch or ascending branch, which ascends between the long head of triceps and lateral head of triceps, and then it anastomoses with the posterior circumflex artery. And anterior or descending branch is also known as a radial collateral artery, which takes part in the anastomosis around the elbow joint. A posterior descending branch is also known as a descending collateral or medial collateral artery, which also take part in anastomosis around the elbow, and the nutrient branch to the humerus. Superior ulnar collateral artery. This artery travels along to the ulnar nerve and posterior to the medial epicondyle and take part in anastomosis around the elbow. Now, inferior ulnar collateral artery. This artery descends anterior to the medial condyle and also take part in anastomosis around the elbow after dividing into the anterior and posterior branches. So thanks for watching. Keep subscribing, keep supporting.